Throughout my life, I've always been exposed to the medical field. I'm a fourth-generation doctor, starting from my grandfather to my dad to myself.
Initially, I knew I wanted to be a surgeon, I swear, as early as third grade.
My dad was a general and thoracic surgeon, and I started operating with him when I was 12 years old. And I always thought I was going to be a cardiothoracic surgeon. And when I was in medical school, my sister actually had an operation, and she went from the most quiet introvert to the most outgoing extrovert.
My early fascinations with medicine would become a family doctor, and then I was exposed to surgery, where I saw the ability to be a family doctor and a technician, working with your hands, designing things, recreating things, rebuilding things, and that fascination led me to plastic surgery.
I always thought I wanted to be a heart surgeon, and I realized that early on in medical school that was really not what suited my personality. And I found a lecture in plastic surgery, and the diversity in plastic surgery, there's no bounds in terms of age or gender of patients and body locations, and that was the most interesting career path for me.
With me, it was just sort of a natural continuum of trying to continue on the tradition that my family established in taking care of patients in addition to taking care of individuals and treat them like they wanted to be treated like family.
So I said to my dad, what happened? And he said she had a breast augmentation. And it was amazing to me that I realized that an operation can totally change the way a person perceives themselves.
You know, with plastics and plastic surgery, my motivation when going through med school was, people either work with the elderly or they work with the young. There's not very many professions that really work from pediatrics all the way up through the people's teenage years and going through. Every age has their own subset of problems. In the pediatric patients, I fix cleft lips and cleft palates. When people get in car wrecks or, in their 20s when they want to have breast enhancement or breast reduction. And those patients continue to be your patients throughout their life because you did their breast reduction or breast augmentation 30 years ago. They come back and see you for your facelift or eyelid lift or something else. And so the continuation of patients and sort of the honesty and rapport that you build from is one of the unique aspects of why I like being a plastic surgeon.
And so I thought, well, I'm going to look into this. So when I was in medical school, I did a 1-month rotation at Stanford University out in California in plastic surgery, and I did a 1-month rotation with one of the best heart surgeons in the world at Jefferson in Philadelphia. And at the end of it, I realized that plastic surgery allows me to look at each problem and create a new solution. You have to use artistry, you have to use your knowledge and your skills to get the result you want. And so every day is a new exciting day, and that's why I became a plastic surgeon.
One of the greatest joys is being a plastic surgeon, knowing that you can dramatically change somebody that would be really secluded and embarrassed about the way they look to somebody who can lead a pretty normal life.